My name is Michael Waddell. I am the director of the Master of Autism Studies program here at St. Mary's, and it is my pleasure to welcome all of you to today's Autism Studies Colloquium. Some of you might have attended our autism training workshops in the past. Those are 1, 2, or 3-day events where we offer training in state-of-the-art autism interventions. These colloquia are more informal events where we get together to talk about cutting-edge work that's being done in the field, usually in a short 1-hour session. If you're interested in receiving more information about our colloquia or our workshops or the Master of Autism Studies program, please be sure to let me know before you leave today, and I'll make sure that we get that to you. In my work with autism, it's not very often that I get to break out my old medieval Latin skills, but every once in a while I do, and today's one of those days. There's an old Latin saying, progressus discipulorum est gloria magistrorum. The progress of students is the glory of teachers. So today we're very happy to be able to glory in the progress of one of our former students, Laura Simon. Laura was graduated from St. Mary's in 2016 with a major in psychology and a minor in philosophy. She then matriculated at The Ohio State University, where she has since completed her master's degree and is now working on her PhD in developmental psychology. Laura's research is at the intersection of autism, anxiety, and Down syndrome, which are common co-occurrences that we're really just beginning to understand the importance of. So we're very lucky to have her here today to talk to us about relations between anxiety and repetitive behaviors in autism and Down syndrome. Please join me in welcoming Laura back to St. Mary's.
Thank you, everyone. It's so nice to have you here, and I'm really sorry for the tight seating, but I'm really glad people are interested in this topic as well. So just so I can kind of get a show of hands of who is in the audience today, so please raise your hand if you are a family member or a direct support professional for children with Down syndrome or autism. Thank you. If you are a professional who is an academic working with children with autism or interested in this topic as well. Okay, sounds good. Thank you so much, just so I have a general understanding. And I see a couple students here as well, so we know. So thank you all for being here. And I want to just start by saying thank you to a couple people first, primarily to St. Mary. Ooh, I'm so sorry. There we go. Thank you to St. Mary's College for having me here, specifically Dr. Michael Waddell for our relationship, and all of the faculty and students of the Masters of Autism Studies. I think it's a phenomenal program here, and St. Mary's is doing cutting-edge work. I'd also like to say thank you to the Ohio State Nysonger Center for some of the funding for this project, as well as the National Institute of Health's Down Syndrome Connect for our recruitment of participants in this study. And then lastly, I'd like to give thank you to my committee for helping make this possible, because this information was based on my master's thesis. And please stop me with questions along the way if you have them. I like this to be an open communication so that everyone's on the same page and we all have a good understanding of this information. So our agenda for today, just so we go through, I know a lot of people here are familiar with either autism or Down syndrome and not necessarily both. So I'm going to break through and talk about what is autism spectrum disorder, and talking about some of the different diagnostic criteria, specifically repetitive behavior, since that is one of the key concepts of this research, so making sure we're all on the same page about what repetitive behaviors are. And then we're going to talk about what is anxiety, because that's our other kind of key construct here we're going to be talking about. We're also going to be talking about what is this relationship between anxiety and repetitive behavior in autism spectrum disorder, and then looking at that in different populations as well. So specifically Down syndrome. So we need to also discuss what is Down syndrome before we look at this relationship between anxiety and repetitive behavior in Down syndrome. So is there any questions before I begin? All right. Let's talk about what is autism. So autism has two key components which characterizes it. So the first is that there are difficulties with an individual with autism with social communication. And we'll go through a little bit more in depth about what that will look like, as well as the presence of repetitive or restrictive behaviors. And these two things must happen in the developmental period for it to be considered autism, because autism is a neurodevelopmental disorder, meaning it really begins in in utero, but you tend to see some of the behaviors occurring later. So some of these things are going to be happening, and they must be present when the child is young. Usually we say before age 3. And just so we're all on the same page, autism spectrum disorder has gone by a lot of names previously. So anything formerly known as Asperger's syndrome, pervasive developmental disorder not otherwise specified, and autistic disorder are all falling under this autism spectrum umbrella. Any questions before we kind of dive into what these differences is? No? Okay. So social communication difficulties, this first key concept of what is autism. So the first part, there are 3 different aspects of social communication difficulties with this diagnosis. And we're not going to go too in depth, but what we want to talk about what that looks like. So individuals with autism have difficulties with social emotional reciprocity. And what does that mean? That means they have difficulty with some of the back and forth nature of social communication. So that could be something as simple as really struggling to play social games like peekaboo, or it could be something where you have difficulty maintaining a back and forth conversation. So that back and forth nature of that communication is really where it struggles, where that is that difficulty. The second is we also see difficulties in nonverbal communication. So that could be something like facial expressions, maybe limited gestures. So I'm up here talking with my hands, and you're going to continue to see me using my hands a lot today. Somebody with autism may not necessarily have a lot of inflection in their voice. They may not use a lot of gesture. They may have more flat facial expressions. So those nonverbal communications, those things that aren't speech exactly, may not be as present. And we also see that individuals might struggle in either making friends, if they have friends, maybe maintaining those relationships or understanding what it means to be a good friend, maybe being in romantic relationships, or just having some of that imaginary play, really understanding the perspective of another person. And that's that understanding relationship piece. And that kind of encompasses that social communication difficulty. Any questions about social communication? All right. And then, so here is our concept, one of these concepts we're going to be looking at in this research today, so making sure we all know what repetitive behaviors are. There are 4 kinds of repetitive behaviors that we're specifically looking at when it comes to autism diagnoses, and different behaviors can fall in these different categories. And to be diagnosed, you only need to have 2 out of the 4 of these to have this diagnosis. So the first we look at is the presence of repetitive speech, motor movements, or use of objects. So that could be the stereotypical lining up toys, lining up toy cars. This could be echolalia, which is repeating the words over and over and over again, so the words you hear from somebody else. This could also be like scripting television shows where you hear, where you can quote every episode of SpongeBob, and you might even be able to functionally use that to communicate in effective ways. The second is having this difficulty with transitions or this insistence on sameness behaviors. So what this means is that you really struggle with going outside of your routine. If you drive to school the same way every day, if there's construction and you're not able to go the same route, it could be very distressing. Really insisting that you have this difficulty with anything out of your usual routine. So that could also be transitioning from one activity to another. So even if they love playtime, but they're eating lunch, they might struggle with that transition from eating lunch to going to play, even if they're both things that they enjoy. That transition is difficult. We also see the presence of restricted or unusual interests. So that could be either an interest that is really, really deep, and abnormal to the intensity of that interest. So it's very common for 4-year-old boys to love dinosaurs or trains. But if the only thing that they can talk about are dinosaurs, then it can become an issue. We could also see unusual interests too. That could be interests in like scrap metal collecting, or the way that a toilet flushes, and being able to flush a toilet over and over and over again, not just in that repetitive motor movement, but just so interested in the mechanisms of toilets. I have a picture of a washing machine on my fridge from something that a kiddo once drew for me, and he really just loved washing machines, and he could do his own laundry by the time he was 5, and I thought that was very impressive and great for the parents. He could only talk about washing machines, so he had a very unusual interest. And then lastly, our repetitive behavior we're looking at is these sensory differences. So either oversensitivity or undersensitivity to each individual sense. So, and this can happen with any specific sense as well. So I like to think of each different sense as a cup for each individual. Some cups are very small. So maybe your taste cup is very, very small, and just one drop of sensitivity may overflow this cup and be too much for that individual, to where they became very, very overwhelmed. But some cups are very, very large, like maybe their touch cup is very, very large, and they need a lot of like deep, deep pressure, deep, deep hugs to kind of fill up that cup and meet their needs. And each different sense has a different sized cup. Why not every child is oversensitive to every sense or undersensitive to every sense, but it varies within each sensory domain. Are we, okay, good. Any questions about this so far? Okay, good. Moving on. So with this, we know with repetitive behaviors as well that this has a specific relationship with intelligence or IQ, and that's specifically related to level of functioning, which is going to come up later in some of my research. So repetitive and restrictive behaviors, we know that individuals with a lower IQ, not just with autism, but also just an intellectual disability in general, tend to have more repetitive behaviors. And so this suggests a very strong negative correlation between level of functioning and repetitive behavior. So here on the x-axis for if we were to have level of functioning here, so this would be a very low IQ and a very high IQ. On the y-axis we had repetitive behaviors, where you have not a lot of repetitive behaviors, but you had a lot of repetitive behaviors up here. You see that on a lower IQ you have more repetitive behaviors, and this. And it's not a perfect correlation, but there is a very strong relationship we know between these two variables. So with this information, we now have a good idea of what repetitive and restrictive behaviors are. So keep this in mind as we move forward and we talk about this in the relationship in autism. But we also need to define our next construct, which is anxiety. Anxiety is something that we use to talk about in everyday life. I'm sure everyone here is familiar with the idea of anxiety as worry. But we're talking here about anxiety that is very clinically significant. According to the Diagnostic and Statistical Manual, which is our kind of Bible for diagnosing anxiety, we use this as a successive fear or worry in situations where this worry or fear is not proportional. And so with this unproportional anxiety, very strong negative emotions that usually results in a lot of physical tensions as well. So this can be very physical, where you have your heart pounding, you have nervous shaking, you have sweating, you have stomach aches. Is very, very common in people with anxiety, because that's a physical reaction to this mental state. And so this excessive worry, this excessive fear. And there are a lot of different kinds of anxiety disorders as well. There's generalized anxiety, which is anxiety in all situations. There can be anxiety specifically for social situations, social anxiety. There can also be specific kinds of anxiety to fear of spiders or different kinds of snakes or weather, things like that. So anxiety comes in a lot of different categories as well. And so looking at this part of anxiety, we're going to now move on and talk about how this relates in autism, since we've defined all three of these things. So what do we know about anxiety and repetitive behavior? This relationship has primarily been studied in autism spectrum disorder. And a lot of this research has been done specifically looking at overall broad anxiety and specific kinds of repetitive behavior. They rarely look at just repetitive behavior as a whole. So looking at some of this research in this relationship, it's primarily done on like insistence on sameness behaviors of repetitive behaviors or other kinds of very key parts. And so I'll be sure to try to define those as explicitly as we can. So in this relationship, these two constructs, as we've just discussed, are very different. We've defined anxiety, we've defined repetitive behavior, and this is something that you're just like naturally, yeah, that makes sense that these are different. But we know in a lot of research, they can be very difficult to distinguish, specifically in populations that have limited verbal abilities or may even be nonverbal. And so a lot of this information that we've known about in these limited or nonverbal populations actually comes from animal research as well. One of the big issues with animal research and this relationship between anxiety and repetitive behavior is that the same behavior in animals, so for a lot of the mice research, is this idea of burying marbles, is defined by different studies as either anxiety or as repetitive behavior. And the studies kind of pick and choose what they're looking at to defining this. So one study may be looking at whether introducing a drug to mice may make them more anxious. And so they say that this example of marble burying behavior that they don't typically see in the typically developing mice population is a symptom of anxiety. Yet, other studies in animal literature are going to be saying, well, actually, we see that there's an increase in repetitive behavior because these mice are burying these marbles. And so this same behavior of marble burying behavior is labeled as both anxiety and repetitive behavior in the field of animal literature. So even though these two constructs seem very different, there is a lot of overlap, specifically in populations that can't necessarily describe saying, you know, I'm feeling a little uneasy right now, and so you can define that as anxiety, or you can say, you know, I'm really bored, and so I want to engage in these repetitive behaviors. Does that, okay, sounds good. Any questions so far? Okay. So some of the things that we know about this relationship, moving on into specifically autism, has to come from some of this research looking at overall anxiety and that specific kind of repetitive behavior. So Gotham et al. Was kind of a leader in this field of helping us understand this relationship between anxiety and one specific kind of repetitive behavior, that insistence on sameness piece. So as we discussed before, insistence on sameness is a lot of that information on that difficulty with transitions, that insisting the things are the same, really struggling when introducing new things. So for example, insistence on sameness can look like insisting on having the same food for dinner every night. It can insist on having your peas lined up in exactly the same way when presenting with a bowl. Sameness could also be that resistance to trying new things. It really is just sameness, not just in routine, but also in just how life is. So that is that drive to school, that is that, that really well-known sameness of, I only know you as a person, so I'm going to continue to have like everybody I know be the same, and really trying not to meet new people, not do new things. Is that? So Gotham et al., when they were looking at this specific relationship, they did a correlational study looking at the anxiety and this part of the of insistence on sameness, looking at 1,400 children, which is fantastic, between the ages of 5 and 18, so right in our population range. And they found a very weak correlation. So correlations are measured on a 0 to 1 scale. The closer to 0, the weaker that relationship is between them, and the closer to 1, that means the stronger that relationship is. And so Gotham et al., they were looking at this using the Child Behavior Checklist, or the CBCL, which, for those of you who are clinicians, know that the CBCL is a broadband measure, meaning it doesn't just look at anxiety, it also looks at a lot of different kinds of behaviors. So it looks at anxiety, it also looks at compulsions, it also looks at depression, it looks at just, it's a broad screening tool kind of to help clinicians kind of narrow their focus and see what could be clinically significant. So I'll discuss this later on as well, but this relationship may be weaker than we expected because only had a few questions in that anxiety subdomain of the CBCL looking at this behavior as well. And so they measured the repetitive behaviors using the repetitive behavior scale revised, which is another repetitive behavior scale we'll see going forward. So we also see that this relationship was examined between specifically anxiety and insistence and sameness behavior in another study as well in the same year by Stratus and LeCavalier. So they looked at anxiety and sameness behavior as well, but their relationship, they were looking at the predictive quality of anxiety and repetitive behavior and different kinds of repetitive behavior as well. So they were looking at 5 to 17-year-olds with autism, and they were looking at it with the same repetitive behavior scale revised as Gotham et al. But they were also using the child symptoms inventory for their anxiety measure. And they found stronger correlation between anxiety and sameness behavior. They found it as about 0.66, which is fairly moderately strong, this relationship. So some research is suggesting that is a very positive relationship here. And then Stratus and LeCavalier also was looking at a different kind of repetitive behavior as well, looking at this ritualistic behavior. And ritualistic behavior is exactly what it sounds like. It's rituals, it's routines. So that's more of that. You want to wake up at the same time every day. You have to eat breakfast at the same time every day. You have to have your bath time routine go in the exact same order, where you put the soap on your right arm, then your left arm, then your right leg, then your left leg, and it can't be any different. So that ritual, where each routine has to be in the same way. And they found, again, the same correlation between sameness behavior and repetitive behavior of ritualism. Does that make sense? So this is very encouraging in this field as well. So we also see a kind of anxiety being measured when we're looking at a different kind of repetitive behavior too. And we are looking at the key sameness behavior again in this anxiety relationship. But we're looking at it in terms of how hypersensitivity, how this piece of being overly sensitive to sensory stimuli, so that could be smells, tastes, touch, might play into this relationship as well. So what that looks like is Black et al. Was doing a study to find out whether that hypersensitivity mediated this relationship between specific kinds of anxiety, specifically separation anxiety and social anxiety, and that sameness behavior. So what that looks like is they said that social anxiety or separation anxiety might lead to insistence on sameness behaviors, but their study found that actually there was a key piece missing in this relationship, and that hypersensitivity was actually this middle variable that was controlling this relationship. So social and separation anxiety actually related to hypersensitivity, which then related to insistence on sameness behaviors as well. So we see like one kind of repetitive behavior, this hypersensitivity piece, being kind of a gatekeeper to this insistence on sameness in this study. Any questions so far? Yeah, so hypersensitivity means being like overly sensitive to sensory stimuli. So that could be if you're sensitive to like light touch, for example, having the feeling of socks just drive someone crazy. It could be like if you're overly sensitive to specific tastes, not being able to eat any food that's not bland. So you won't be able to eat any pepper or even possibly salt. And it varies accordingly with each individual as well. Each individual is different. Good question. Any other questions? Yes?
Were you saying so that one hypersensitivity causes another one, and that's what causes it to be more aggravated?
So what actually is happening is just like hypersensitivity in general. So people that have that hypersensitivity piece, kind of the separation anxiety goes through hypersensitivity to get to insistence on sameness behavior. It's not necessarily social anxiety leads straight to insistence on sameness. Does that answer your question? Yeah. Okay, good, thank you. Other questions? Okay.
Is it possible for it to take without the middle piece?
Yes, and I actually am so glad you asked. So remind me at the end, I have a different slide that shows more of a statistical model of this relationship, but it is possible to have social and separation anxiety lead directly to insistence on sameness behavior, but this is just showing that a lot of this interaction is happening through this hypersensitivity. It can lead directly from A to B. Good question. Any other questions so far? Okay, thank you so much. And so we also see that other studies have also looked at this hypersensitivity piece in this prediction of repetitive behavior as well. So Boyd et al. Was looking specifically at hypersensitivity in relation to different kinds of repetitive behaviors, such as the stereotypies, which individuals who are familiar or work with people with autism or Down syndrome with repetitive behaviors know. Stereotypy is some of this repetitive motor movements that might be more stereotypically like hand flapping or finger posturing, just something that's more of like this repetitive motor behavior. And we also found that Boyd et al. Found this hypersensitivity piece was related to compulsive behaviors as well. Some people might think of compulsion as explicitly only relating to maybe obsessive compulsive disorder, but we see these pieces in repetitive behavior as well. So compulsions are things like having to repeat things in your head or repeat things out loud. It could be counting. It could be repetitive tapping or touching. these compulsion behaviors where you have to engage in this behavior to kind of alleviate some of this anxiety. And then, yeah, and then this hypersensitivity piece they also knew were related to those rituals and sameness behavior that we've already spent a lot of time discussing. And so they looked at this, looking at 67 children with autism, as well as 42 children with just a developmental delay, including Down syndrome as well. And they were looking at this using that same repetitive behavior scale that we've been looking at, the RBSR, and Sensory Experiences Questionnaire, or the SEQ. And so kind of looking at this behavior in other instances as well, we want to examine this relationship between anxiety and repetitive behavior in children and see why this is happening. So we have a lot of information that this relationship exists and that it's happening, but we want to have more of this information of like getting at this function of this behavior, this drive of why this is happening. And so Justin Bundy and Einfeld looked at kind of this understanding of how is this repetitive behavior and this anxiety looking at this. So what they did is they had 37 children with autism who also had an intellectual disability. So this is some of these, like, I don't love this term, but like lower functioning. So they had lower IQs. They might have adaptive behavior, but really that intellectual disability piece. This is not the children that are like Aspies that have Asperger's syndrome or higher functioning. And then they also had a control group of 37 children with an intellectual disability who did not have autism. And they were trying to understand whether or not in different experiences in their daily life they saw the presence of repetitive behavior and suggesting why that might occur. So looking at that piece of autism, those with autism and an intellectual disability, we saw that they engaged in repetitive behavior when they were in periods of anxiety, when their anxiety was very strong. So they saw maybe this is a relationship of a negative reinforcement, or trying to engage in repetitive behavior more to reduce that anxiety. And this wasn't an experiment. It's hard to ethically make someone super anxious to look at that, but they suggested that there might be a lot of that piece going on where they're trying to reduce this anxiety with this repetitive behavior. But they saw a different function of repetitive behavior for children who do not have autism. So these children with intellectual disabilities without autism actually tended to have more repetitive behaviors when they were very bored. So when they were trying to engage in sensory stimulation, was that key piece. So if they were in a very sensory stimulating environment where there was a lot of going on, there's a lot of fun, there's a lot of things happening, we also saw that they were less likely to engage in repetitive behavior, suggesting that repetitive behavior may actually be, sensory stimulating for them. They're bored and they want to do it. But we also saw that they engaged in more repetitive behaviors during times of transition as well. So that might relate to that repetitive behavior of difficulty with transitions, and so that might also have this piece of I'm really anxious, things are moving and changing, and I want to engage in this behavior to help me feel better about this. Any questions so far? Okay, sounds good. So kind of moving out of this realm of autism, Rogers et al. Looked at this relationship between overall total anxiety as well as overall total repetitive behavior. And they did that in the field of autism. They had 34 children with autism between the ages of 6 and 16, and they were looking at the repetitive behavior questionnaire as well as a specific anxiety measure looking at that anxiety. And they found that in this population, they also found a very similar correlation, a pretty strong correlation between anxiety and repetitive behavior as all of the research I've talked about. But they wanted to look at this relationship outside of autism as well, and they wanted to examine that in children with Williams syndrome. So Williams syndrome is caused by a deletion on chromosome 7. It typically relates into difficulties with intellectual functioning, but also has a lot of high social behavior, has a lot of high musical ability as well. So this is actually a picture of Gloria Lenhoff. She has an IQ of 55, so she may struggle with some more like basic life skills like making change for $1. But Gloria is a leading soprano in the San Diego Master Chorale. She is very impressive and has an absolutely beautiful voice, as a lot of people with Williams syndrome do with their musical talents. And so looking at this relationship between anxiety and repetitive behavior in Williams syndrome, Rogers et al. Didn't see this relationship maintain as well. It had a very small correlation of 0.12. So they were kind of this first in seeing, does this relationship maintain outside of this relationship with autism? And that's where I began to find interest in this as well, is I was looking at this relationship, seeing it's very well established in autism, but doesn't apply to other people with intellectual or developmental disabilities, which is why I wanted to explore this in children with Down syndrome as well. So before we look at this relationship between anxiety and repetitive behavior in Down syndrome, let's first define what Down syndrome is so we're all on the same page. So Down syndrome is caused by having 3 copies of chromosome 21. So with some people with Down syndrome, what this does is they might struggle more with expressive communication, so that's, and having that impaired speech. I had a image coming up, but expressive language is that idea of what you say to other people and how you're communicating your words, not necessarily understanding what is said to you, but what are you saying. And so with that understanding of what are you saying, this also relates to maybe having some more slurred speech or having with your speech intelligibility or what is being understood by other people limited. We also see that people with Down syndrome may struggle more with some of that long-term memory, especially that verbal piece, so seeing how verbal abilities is a little bit more challenging for people with Down syndrome. But they have a really strong visual spatial memory instead. There we go. That's our little visual I would been missing for a minute. So that's that expressive piece. And so with Down syndrome, we know this is the most common genetic cause of an intellectual disability. And what an intellectual disability is that's a neurodevelopmental disorder that's characterized by not only like potentially lower IQ, so that difficulty with intellectual functioning, but also problems with adaptive behavior, which is that daily living skills or your ability to help dress yourself, maybe make change for $1, things like that. And people have different varying levels of intellectual disabilities as well. So when we're talking about all of this relationship between anxiety and repetitive behavior in autism or Down syndrome, I just want everyone to know, so we know about 38% of individuals with autism also have an intellectual disability at the same time, and 16% of individuals with Down syndrome also have autism. So what we're looking at here is we're not necessarily looking at this relationship in people that have Down syndrome and autism. We're actually looking at it in people with autism or with Down syndrome, because we know that individuals who have autism all have repetitive behavior. It's a diagnostic criteria. So we want to make sure we're looking at this with people who might not necessarily have that autism diagnosis to see what is this relationship outside of autism specifically. Any questions so far? Okay. So when I'm looking at this specific relationship in Down syndrome, what are we trying to do? So we know that a lot of individuals with Down syndrome have an intellectual disability, not necessarily all, but most. And so with this knowledge that 28% of individuals with an intellectual disability have an anxiety disorder, one would assume that most people with Down syndrome would have a similar rate of anxiety disorders as well. And that's something that you would just hear this information and say, well, if Down syndrome has an intellectual disability, if an intellectual disability it has 28% have anxiety, you'd think almost 28% of people with Down syndrome would also have anxiety. And the rate of anxiety in Down syndrome was actually fairly difficult to find. And we actually know that this number is a lot lower than what we would expect. Only about 8.5 people, of adults at least, with Down syndrome have anxiety disorders. So there's still more research going on about whether this is a true rate of anxiety disorders or whether that might be related to difficulty with that expressive language piece that we talked about with Down syndrome, where they might have difficulty expressing being worried, expressing having that fear, or maybe expressing like those physical symptoms. Or it could be a true prevalence, but more research is kind of being done on that. Yes?
This study sort out, children with Down syndrome have big tongues that are coming forward and larger adenoids, and that may affect their expressive versus actually the intellectual component that may express it, so anatomical versus intellectual.
So you're looking at whether the anatomical piece of Down syndrome may impact that expressive verbal abilities. So that information was not necessarily discovered, but that could be one reason. We don't really know exactly what is with that piece, but the physiological as well as that expressive, like intellectual piece may be part of that as well. But it's really hard to figure out specifically. But very good question. Dr. Deal, did you also have a question?
Yeah, it'd be interesting, you know, if you are to look at this piece with Down syndrome to think about part of that lower prevalence might be less of a likelihood to give some sort of other diagnosis to somebody with Down syndrome, and might just say, oh, this behavior or this emotion or whatever it is just kind of part of Down syndrome. I tend to see that more with Down syndrome than I do with other diagnoses. So maybe something you might want to consider. That might be contributing to why it's so low.
Yeah, so contributing to that, maybe that diagnostic overshadowing piece where you're attributing a lot of this information to the Down syndrome diagnosis and not necessarily wanting to add a separate diagnosis on top of that. I completely agree with you that that may be one of the reasons that this is maybe lower than what would be expected. But more information hopefully is coming on that soon. Good question. Other questions? Yes?
I wonder if the intellectual disability was diagnosed through a verbal measure, or if it was a nonverbal measure, like the lighter, that determined the intellectual disability.
So whether or not verbal abilities go into that intellectual disability diagnosis. So this information was just based on like the Diagnostic and Statistical Manual, as well as other studies by like Elizabeth Dykins et al. And so I'm just going to say like good clinicians will hopefully use the lighter in addition to verbal intellectual tests of functioning, hopefully to determine an intellectual disability, but I don't know specifically because, but I can look it up for you if you're interested. Thank you. Good question. Other questions? Okay. So we know, so this is a lot lower than what we would be expecting, but even though 8.5% of people with Down syndrome have an anxiety disorder, that's still significant, especially for those people with that anxiety disorder, as well as the fact that people with Down syndrome might be experiencing symptoms of anxiety without having it be like clinically significant disorder as well. So they still might be experiencing anxiety. So we still wanted to consider this viable for this research. Because we also knew that the second construct we were looking at, repetitive behavior, the majority of children with Down syndrome engage in repetitive behaviors, even those who aren't diagnosed with autism. 60% engage in repetitive behaviors. And so that's a lot when you're thinking of how many children engage in this repetitive speech, this repetitive motor movements, or things like that. So we really want to look at this piece because it's clear there are people with anxiety, and that's really impactful, and most of them have repetitive behavior. So is there a relationship between these two constructs? So what our research did, we went for this relationship because we wanted to have a better understanding of behavioral phenotypes and what does that mean to have Down syndrome and experience anxiety. What does behavior look like in children with Down syndrome? And we wanted some clarification on that. We also wanted to make sure that children with Down syndrome were getting the best possible diagnosis so that that could inform better treatment for them. So making sure if they do have repetitive behavior, that maybe this repetitive behavior is not necessarily part of an autism diagnosis that's being overlooked. And we also wanted to, and this would be diagnosed with the Diagnostic and Statistical Manual that I've mentioned before. And we also want to make sure that, like Dr. Deal had previously mentioned, that people with Down syndrome may be experiencing anxiety disorders, but people might just say, oh, that's because they have Down syndrome, without actually figuring out whether they have anxiety disorder as well, and then they wouldn't be able to get treatment for that. So making sure the most accurate diagnoses are possible. We wanted to make sure that whether or not they get the best diagnoses, that informs better treatment for not only the individuals with Down syndrome, but also their families. So that's kind of this key piece of we want this to matter to the individuals and the families of people with Down syndrome. So we had two main research hypotheses that we were looking at. We wanted to look at whether there was a relationship between anxiety and repetitive behavior in children with Down syndrome. And we measured this expecting a moderate relationship based on some of the literature. And we looked at correlational data just like the literature suggested as well. And we also wanted to look at this key piece of this level of functioning. So level of functioning we know is related inversely to intelligence quotients or IQs. So those with lower IQs have more repetitive behavior. So we wanted to see whether that was a piece of this relationship as well. So does level of functioning moderate or impact this relationship between IQ and repetitive behavior and anxiety? And so we hypothesized that it would not be related because those with Down syndrome tend to have more mild or moderate intellectual disabilities. And we looked at this with regressions, statistical analyses. So what we did is we recruited 76 parents of children with Down syndrome between the ages of 6 and 17. The mean age of our participants were 10 and a half, so pretty representative sample here. And we recruited them through the National Institute of Health's Down Syndrome Connect. And I want to say thank you very much for all of the work they did to help make this research possible as well. And when we were looking at this relationship, we excluded anyone with previous diagnoses of autism because we knew that that might artificially inflate this relationship, because we know everyone with autism also has repetitive behaviors, and any other genetic syndromes that may or may not be impacting this relationship as well. And so what the participants did is they took an online Qualtrics survey, the parents did, that included an anxiety measure. And you might notice that it's called the Parent Anxiety Checklist specifically for autism spectrum disorder. So that might seem like an odd choice. But the reason we did this is because this is a new anxiety measure that has been piloted that is based more on observable physical characteristics of anxiety rather than that self-report. Because we know children with Down syndrome might struggle with some of that reporting of anxiety. And so we're looking more at things like physical tension. We're looking at things like heartbeat and sweating. We're looking at things might be easily more observable, which this was created for people with autism, but also applies to others in intellectual and developmental disabilities. And then they also took the repetitive behavior scale revised, which has been used very many times in the literature, specifically by a lot of the articles we talked about earlier today. And they took an autism screener, so the social communication questionnaire, to kind of just give a broad screening to see, like, do they have a lot of autism symptoms? It a very in-depth measure of autism, but we just wanted to make sure and say, like, you know what, there's not a lot that might be at play. And we looked at their level of functioning with the conceptual domain of the Adaptive Behavior Assessment Scale, or the ABAS. And then we asked demographic questionnaires of the children of interest. So looking at our results, what did we find? Does this relationship exist or not? I was very happy to find out that this relationship does exist and is statistically significant between not only anxiety and overall repetitive behavior. So that correlation is 0.69, which is very similar to what we've seen in the literature. And here, this p-value here means that it is statistically significant. It is not very likely due to just chance. So this relationship also maintained between anxiety and different kinds of repetitive behavior as well. So we also saw this in that stereotypical behavior, that stereotypical use of objects like lining up toys, that stereotypical speech where you're repeating things over and over again. We saw that this was related to self-injurious behavior, but this correlation of 0.24 was a little bit smaller than the rest of them. And I'll discuss why that might be in a few minutes. But this behavior is not necessarily as related to self-injury, which has a repetitive quality to it. We did see anxiety and repetitive behavior was also significant for compulsive behaviors, which we've talked about, that repeating, that counting, that tapping, that need to do something to that behavior to make it go away. Also saw that ritualistic behavior, that routines, that need for order, this need to have things done in the same way, a ritual done, was also significant, and that sameness behavior, that insistence on sameness that a lot of the other literature has decided as well. We saw very similar correlations between anxiety and sameness behavior. And lastly, also restricted behavior, those restricted interests, that restricted unusual interests as well. So a lot of really great information here. And when we were looking at these results, we also saw that when controlling for symptoms of autism, that these results maintained as well. So we conducted post hoc partial correlations, kind of making sure that when we're looking at those autism symptoms, that those relationship between anxiety and those different kinds of repetitive behaviors was not being unduly influenced by symptoms of autism. And we saw that all of them maintained except that self-injurious behavior. And so one of the reasons why that might be is that we might see a different function of self-injurious behavior. It might not necessarily be to reduce symptoms of anxiety. It might not be because you're engaging in this repetitive behavior because of a relationship between anxiety and repetitive behavior. Self-injurious behavior might be because of different reasons, like you're having some boredom or anything like that. And that so self-injurious behavior may be a different beast when it comes to repetitive behavior. And we saw that this partial correlation also maintained between anxiety and these different kinds of repetitive behavior when not only controlling for symptoms of autism, but also IQ as well. And again, everything maintained again except the self-injurious behavior. And for those of you taking notes, I'm happy to share my slides at any point rather than having to have you write it all down. I'm so sorry, I should have mentioned that earlier. And so with this partial correlations, this relationship is there and it maintains. And so we also wanted to examine whether or not this relationship between repetitive behaviors and level of functioning was there as well. So we looked at that using regression models. So this is a conceptual model of what a regression looks like. So I looked at it from both directions, where anxiety was an independent variable and anxiety was also a dependent variable. And basically the take-home message was that there was no relationship with intellectual function influencing this relationship in any direction. And I'm happy to go into more details with that if you're interested later. But for the interest of time, we're just going to talk about why this matters. So a lot of this information between this relationship is been known mostly in autism. And we wanted to expand that to talk about this relationship in the field. And so this relationship in Down syndrome is almost equivalent to the literature in the field of autism as well. So we found anxiety and total repetitive behaviors to have a correlation of 0.69, which is exactly the same as, I believe, Rogers et al. Yes, Rogers et al. Study. We also found this to be between anxiety and sameness behaviors to be stronger than that relationship that Gotham et al. Looked at, but we know that Gotham et al. Didn't use an anxiety-specific measure, so that might explain why we found stronger results. But our results were the same as Stratus and LeCavalier's, which looked at that sameness behavior piece as well as that restricted behavior piece, and we found the same exact correlations of their relationship in autism as we found in Down syndrome. And so what does this mean? This helps us have a better understanding not only of anxiety and repetitive behavior separately, but also together in the field of autism research. This contributes to this in other populations, and it helps us get this better understanding of behavior in Down syndrome. This helps us have this better behavioral phenotype that hopefully leads to more accurate diagnoses to help prevent people misattributing symptoms of anxiety or repetitive behavior to their Down syndrome or intellectual disability, which is called diagnostic overshadowing, where one diagnosis overshadows a potential mental health diagnosis. And this helps us get better services for not only these individuals, but also their families. So it helps inform treatment possibilities as well. And just a quick limitations discussion. Not every research is perfect. There were a few mistakes. This survey was distributed over the internet, so that means that people who were not parents of children with Down syndrome could have potentially taken the survey. It's very unlikely, but it's possible. Anything's possible on the internet nowadays. And we also know that the level of functioning was not a direct measurement of IQ. It was based on parent report, which also has its influences. We know that the symptoms of autism that we were looking at was assessed via a screening tool. It wasn't, again, an in-depth measure of autism symptoms. They didn't come into the lab. I didn't give them an autism diagnosis or test or screen out for it. I was just on a 40 item scale. And we didn't ask about the person completing the survey. We just asked about the child of interest. So I didn't know whether this was done by mom or dad or things like that. And so where do we go from here? What are some of the future directions for this research? Obviously, we want to look at what the direction of this relationship is. Is anxiety leading to repetitive behavior and causing someone to engage in more repetitive behavior when they're anxious? Or is it someone is engaging in repetitive behavior to reduce some of that anxiety? Or is it another third option that we just haven't thought of as well? We also want to explore this in other children with intellectual and developmental disabilities. It's been looked at in Williams syndrome and Down syndrome now, but we want to look at other syndromes and things to help more people and expand this research. While doing this research, we also found that there are no self-report measures of anxiety for children with intellectual disabilities. So whether or not that expressive behavior piece is possible, looking at whether or not this would be useful for the field to have children report on their own anxiety, because there can be some issues with parents reporting the symptoms someone else is feeling that they might not be expressing. There could be some issues with that. And then we also want to look at other factors that could play into the relationship between anxiety and in autism specifically, which is where my dissertation research is heading, looking at some of those environmental factors like parenting styles, socioeconomic status might have in the development of anxiety in autism spectrum disorder. All right, what questions do you have? Yes, we'll start over here.
Just a second.
Oh.
I'm going to ask you, please, everyone, to use the microphone. Even though you don't need it to be heard in this room, we need it for you to be heard on the video.
Okay.
Thank you.
Thank you for this lecture. It was great.
Thank you.
So the one thing I didn't notice is, has this altered the direction in any way of therapeutic options for individuals with anxiety disorder or Down syndrome to reduce the RRB? Have you come up with any kind of therapeutic modality that's different?
So this is very, very recent research that is still in the works of being published. So this is not necessarily impacting treatment right now, but we do hope that it will. And a lot of that is there's also information on repetitive behaviors where like how important is it in reducing repetitive behaviors, specifically if they are related to anxiety symptoms, which one should be targeted first. And that's why, because this is such infantile research, we want to make sure that it's just, we know that this relationship exists because of this research. We want to necessarily take that next step to see what may be causing what before we can look at, okay, how do we target that treatment? Thank you.
We're on the same wavelength here. I'm actually going to follow up on that question. This is awesome for a master's thesis. This is really high level. You did a really good job. I'm curious, though, just maybe to take your question a little bit farther. I'm curious what you think.
Yes.
Let's say that anxiety has a relationship to repetitive behaviors in the sense that repetitive behaviors are being used to reduce the anxiety.
Yes, very possible.
So, and a
Bless
lot
you.
of our interventions right now, some of them are focused on reducing restrictive and repetitive behaviors.
I understand, yes.
So let's say that this is the case. What would be your recommendations for somebody who's pursuing therapy within this realm of anxiety and repetitive behaviors? Is it still good for us to be focusing on this as an intervention source? And how would you approach that issue?
I'm so glad you asked that, because that kind of is that bigger question here of where is this useful in this treatment for families and for treatment providers giving this. And so the short answer is we don't know the directionality of this yet. So hopefully in further research we can explore this. Repetitive behaviors will or will not impact anxiety. And because all diagnoses are such on an individual basis, it may be different for different people as well. So I would suggest clinicians specifically at Logan, who maybe what you're thinking of, should just really look at before, after, or during treatment, the anxiety symptoms of when you're looking at the repetitive behavior reduction. So maybe looking at what is the impact of this, making the anxiety worse? Will it get better over time? This is getting really, really bad in the middle, but once the repetitive behaviors have been successfully reduced, is it still elevated, or is it kind of going back to the baseline of where it was before? And so I think in the short term, before we have answers on the direction of this relationship, maybe keeping a very careful eye on what's happening in treatment, which I'm sure you're already doing anyway, because it is so important to look at the overall effects of treatment. Does that answer your question? Let's go in the corner first. Oh, thank you. Hi.
Hi. So what's the difference then between repetitive behavior and OCD?
So repetitive behavior can sometimes be seen in OCD. It's not necessarily the same thing. So OCD is characterized by that obsession compulsive disorder. Obsessions are really like that internal thought process, that internal thoughts of a monologue where something's going to happen to you or your family or things like that. And so you engage in compulsions to reduce.
So that's just a thought. I have a 20-year-old with anxiety and OCD, I believe, but his repetitive behavior. But what I find is his repetitive behavior calms him down. So I'd rather see the repetitive behavior than the anxiety.
And kind of a choice that you can make when thinking of treatment goals. And that's very true, where the compulsions can look very much like repetitive behavior. It could be repetitive behavior. We looked at specifically compulsions as a kind of repetitive behavior. So maybe like repeating or counting or tapping or things like those compulsions can temporarily make the obsessions go away.
Yeah, his is more like wanting, he likes Thomas, so he has a little eye touch, but what I've noticed is he'll watch the same video for certain things when he's getting dressed or when he's eating. It's a certain video for certain things. So, like I said, as long as it's not interrupting his daily life, I'd rather see him do that than have anxiety.
Yeah, I think that's just something you can talk about with your treatment provider to see like what your treatment goals are. And so, there was another question back here. Thank you so much.
I actually was in the same line with the treatment question, so I think we were all thinking similarly. But I had another question, because I work with this pretty much every day. Was there any recognition in any of the literature of the function of the motor stereotypy? For example, I have a lot of clients who are excited, and we see their motor stereotypy increase when their favorite item, animal, person is present.
Yes.
And I would not associate that in reality with anxiety at all.
So that's
And
definitely
when
one
they
of the
become
things we
more
see.
vocal, they often actually communicate with us that they're really excited. So was there any recognition of that? Because it could skew data. Do you know?
So that is something that the literature did talk about, is the function of behavior, specifically those Justin et al.'s article.
Okay.
So they were looking at it more of that in line with the piece of what's happening when they're under anxiety or stressful conditions. And do you see this also going up in times of boredom? They weren't necessarily looking at it in times of joy. So it could potentially skew data, but I will do a more thorough literature. There's not a lot on the function of behavior. That was really like the only article I was able to find on why these behaviors occur.
Sure.
So that could be a potential future look into research as well. But if you're interested, I can look more thoroughly into the
Sure.
literature and the
I mean,
function and get back to you.
anything. Yeah, I just noticed an intake when you're going with parent interview. Obviously, they're so interested in their individual that they're caring for, and so I often have to ask follow-up questions to actually determine when the behavior happens and what's surrounding the behavior, because it greatly impacts how the parent should respond
Agreed.
and what treatment approaches we should have.
I agree.
And so I usually, if we just say, do you have repetitive behavior? 90% of our families say, sure, yes. And then, do they want to change or transition? No,
No.
never from their favorite item. But do they have a hard time going down a different road when there's construction? Some do, some don't. So like an overall broad generalization question of difficulty with transitions or change can be very specific. So those are just things, I think, in my nerd level of analysis that I think about from a treatment standpoint.
I completely
So,
agree, and I
yeah.
think that's where like the beauty of having people come in and being able to conduct in-depth interviews and
Sure.
maybe being able to do some of that IQ assessment or autism assessment directly is so important,
Yeah.
and that's why it was such a shame that a lot of this information was based on internet survey,
Sure.
because you don't get as rich data
Okay.
like you're suggesting.
Yeah.
I think we have time for just one more question in the back.
Hello. I think this really plays a part too when it comes to transitions for our kids when they're for example, like going from elementary to middle school, for example, that I'm living through right now, where they're used to the same routine, same things for 6 years, then they go, and it is these things that you have to have written in the IEP. I think it's critical, and thank you for doing this research, because it really helps for the parents to advocate for their kids to say, listen, we need this, this, and this to be followed. And when you're writing out the behavior plans and everything else, to have all those things detailed. Because when you have those things in place, you're able to help your child, because they're more predisposed to have those behaviors happen when they're used to all the same routines. So thank you.
Agreed.
Not a question, but more support, because whether it's medical, that they get the anxiety, or the psychs at the schools are doing this testing, it will help support what the parents are trying to put in place. So thank you.
Thank you. Thank you for saying that. I really appreciate it.
Seems like there ought to be a better system, doesn't it? Well, if you're interested in receiving more information about future Autism Studies Colloquia, about our autism training workshops, or the Master of Autism Studies program, we have lots of material here, or you can talk to me, and I'd be happy to get that information to you. I'd like to thank all of you for joining us at today's colloquium, and ask you please to join me one more time in thanking Laura Simon.
Thank you.